This is Paul Windsor, second year Bachelor of Nursing student, University of Adelaide. This is my introduction for Assessment 3, Employer Competency / Teaching a Client Patient. I am currently on placement in theatre, therefore dispensation has been granted to fill my assessment on a family member. Names and situations of the family member is fictional, however consent has been obtained from that family member to pose as an actress playing a fictional patient. So, this setting is in a standard acute teaching hospital on a respiratory ward, and the patient goes as follows. She is 30-year-old female, no significant previous medical history apart from a smoking pack year history of about 8, not about 8, exactly 8, and is currently seeing her GP for smoking cessation therapy. She was admitted to hospital approximately 10 days ago with severe shortness of breath, fever of around 39 degrees C, muscle pain, fatigue and malaise. She was also desaturating a little on room air, about 94%, so she has been on oxygen. Her saturations on leaving today have already been assessed and they were running fine at 100% oxygen on room air. Observations and diagnostics within hospital led to a diagnosis of community-acquired bacterial pneumonia. Following a course of IV antibiotics, amoxicillin, she improved markedly. However, during her recovery, she developed a persistent wheeze, which responded well to courses of inhaled salbutamol. Spirometry was carried out, and respiratory physicians have diagnosed our patient with asthma. She has improved well enough to be discharged, and an asthma plan has been developed. PRN salbutamol has been prescribed, as well as a short continued dose of oral amoxicillin. So the purpose of today's education is to 1. Run through the patient asthma management plan. As I've already said, oxygen saturations have already been tested and are running at 100% on room air. Pulse is fine at 70 beats per minute, and the respiratory rate is 18. She hasn't been on a monitoring since her improvement. Cardiac function, even when she was unwell, was fine. She was in sinus rhythm. The respiratory part of her asthma plan, the purpose of it is to teach her about her warning signs for her asthma, and hopefully she won't go downhill as badly as she did last time and bringing her into hospital. 2, we will be educating the patient in use of her prescribed salbutamol. This will be done via the use of a metered dose inhaler, and that will be carried out both with and without a spacer. The third goal is to educate the patient in what to do if things go wrong, and again we'll be using the action plan to do this. 4, we will be educating the patient on the use of her antibiotics, and as you'll see, the patient is quite keen to go home, so we'll give the information as best we can within what I hope to be a semi-realistic environment, where upon discharge patients are keen to get out of hospital, keen to go home, keen to get on with their lives, but it's very important to show them what to do, how to manage their chronic condition. And on to the video. Hi Emma, I'm your nurse Paul today. Are you pleased to be going home?
Yes.
Good. Now, before you go, are you aware that you've recently been diagnosed with asthma?
Yes, but I'm not sure what that means.
Well, asthma is a chronic disease of the airways. The airways are the tubes that carry the air from the outside into our lungs. And sometimes it's harder for a person with asthma to breathe, but other times their breathing is normal. Now, with asthma, it can cause several symptoms, but when you were very unwell, we found that you sometimes have a wheeze, which is that high-pitched sound that you were emitting, and very often you're quite short of breath, so that's the feeling of not being able to get enough air. Now, did that sound like you?
Yes.
And do you remember we gave you some medication to help with those symptoms?
Yes. But how do I get asthma?
Well, with asthma, it's a chronic disease, so it might have gone on for several years unnoticed. Now, the reason we found it is because you were in with pneumonia, which is now almost better, it might have caused a flare-up in that asthma. Now, as I've just said, you might have had that for several years and not known about it. Now, you being in hospital allowed us to pick up on those symptoms, and that's why we were able to give you the diagnosis of asthma. Now, going back to the medication, we found that those symptoms were helped by some of the medication we give you, and I'll go through those in a moment. And also, when you go home today, we're going to give you some antibiotics to help with the pneumonia, or just to finish it off, so to speak. So the whole point of this education session, and why we're keeping you in hospital for a few minutes longer, is to 1, check you're still okay to go home. 2, give you a plan to help you manage your asthma. 3, show you how to use your asthma medications. And 4, show you how to use your antibiotics. Make sense?
Will my asthma go away? Am I going to get better?
Well, although your pneumonia is almost gone, the asthma is what they call a chronic or a long-term disease. Now, although that means there's no cure, not a disaster because lots of people have asthma. I think there's about 2 million Australians who have some form of asthma. And most of those people, if it's managed well and has you follow all the guidelines and that sort of thing, you can live a good standard, good quality of life. Okay? So, like I say, the purpose of the asthma plan is to keep you healthy and keep you out of hospital. Sound alright?
Yes, shall we get on with that? I really want to go home.
Yeah, fair enough. You know what? I think we all want to go home sometimes. Okay, so we won't be much longer. So I'm going to ask you some questions, and these are going to relate to how you feel now, on the day of going home, not how you felt when you were really bad, about a week ago. So do you have any cough at the moment?
No.
No? And are you in any pain, particularly when you breathe in or breathe out?
No.
And do you have any other problems breathing?
No.
And do you have any wheeze at the moment?
I did when I was unwell, but it's gone now.
Great, thanks for that. Now, when you were unwell, do you remember how it felt to breathe?
Yes, I was very short of breath and I could hear myself wheezing when I was breathing out. My chest also felt very tight and was very painful. It was hard to breathe. I could even feel my shoulders and neck muscles helping me to breathe.
Well, it's that sort of thing, that sort of symptom that we really want you to be aware of in the future. Now, by going through the asthma plan today, we can reduce the things getting to that really bad stage and hopefully teach you to pick up on the warning signs before things get bad. So, we've got your asthma plan here, as I've just said, that our respiratory doctor and our clinical nurse have prepared for you. Now, it's really important you either remember this or print off a small version of it, just keep it on you and be aware of it, right? Because certainly in winter, that sort of thing, and you might have a cold or something like that, asthma really can creep up on you, so it's important to really recognise those warning symptoms. Also, on this plan, I've given you a web address for one of the asthma associations. It's a really good website and it provides some clear, expert answers and really goes over about what we're going to go over today. Okay, one of the really good things on there, there's some videos that really reinforce how to use the medication. So if you're ever unsure, go on Google National Asthma Association, click on the links and away you go. And then the final thing, if that doesn't answer the questions for you, just go back to your GP for its help. Now, I did say final thing, but I lied. One more final thing. If things are really, really bad, when we get to what we call the danger signs here on the asthma plan, it's important that you call for an ambulance, okay?
Okay, can I go home now?
Note to the assessor, this is the pre-printed asthma plan, Ethan, that we're going to use for Emma. This will be attached to one of the documents I've uploaded, so you'll be able to review it to check the information we're going through is correct. Okay, Emma, so we've got your asthma plan here. We're almost done. Pre-filled, as we already said, so name, GP, important to know, emergency contact details. That's why it's really good to keep on you. If you're getting any problems, you can just wave it at people and they'll see you're in problems. Now, your asthma is fairly mild, so there are all sorts of medications that you can be given for asthma. But they kind of fall into two main fields. You have your preventers and your relievers. Now, in your case, it's still quite mild asthma, so you actually don't need a preventer at the moment. You just need the reliever. If you could pass me the little inhaler there. So this here, do you recognise, seen one of these before?
Yep.
And what do you think they're called?
A puffer.
A puffer. Okay, yeah, puffers, I prefer inhalers, but most people call them puffers. And what type of medication do you think is in there?
No idea.
No idea. Have you heard of Ventolin?
Yes.
Alright, Ventolin is a common name. The proper name for it is salbutamol. You might also hear it called Ventolin or Asmol. And what this is a bronchodilator medication. Now, what do you think? Do you have any idea what that means? Okay. So with asthma, when you're having an asthma attack, what's happening is the tubes or the bronchioles, or the bronchus and the bronchioles, which are your two tubes that go down into your lungs, they're lined with muscle, and they can become, for whatever reason, they can have too much mucus in them, or either for another trigger, might be hay fever or smoke or something, and it sets them off and they start to constrict, and that's why you have problems breathing, because they're either spasming or they're closing up. And just like a blocked pipe or something, the more it's on the inside, the smaller the diameter, the harder it is to get the air in, and that's why you really struggle to breathe, and that's often what causes the wheeze as well. Now, all this does, salbutamol, Ventolin, is just relaxes those airways and dilates those tubes. That's why they're called bronchodilators. Alright? Make sense? Dead easy. So, what this form goes through, it goes through with when you're well, when you're not well, if you get worse, and if you're in trouble, basically. So the first one, when you're well, you're going through it. So your preventer is, already said, you don't have one at the moment. What I suggest you do, we'll come on to it, hold that thought, we'll come back to that. So this is your reliever. So as required, whenever you feel that you're a bit short of breath, 4 puffs, on you go, as required. This will, it's quite quick to take into effect, probably a couple of minutes to work, and it generally lasts for sort of 3 to 4 hours. Now, we have also given you something called a spacer, and that makes more of the medication go down into your lungs. So it's better to use a spacer and carry one with you. It doesn't always happen, so if you have only got this, then this is fine, but preferably to use with the spacer. Alright, so now we've got it, we'll go through the medication. Alright, so you have any idea of how to use these?
I think so.
You think so? Alright, let's assume you don't, and we'll go through it. Now this is a dummy one, so I'm able to inhale this and it won't have any effect on me. Alright, so what we're doing is standing up nice and tall, really opening up your airways, and then you take a big breath out, and then when you come to breathe in, you breathe in with a sharp inhale, because you're trying to get all the air into your lungs. And when you do that at the same time, you have a little squeeze on here. Alright? So, and then you hold it for 10 seconds. So I'll just show you. Chin up if you can, breathing out. Six, 7, 8, 9, 10. So you really want to make sure it all gets down into your lungs. Alright, makes sense? Want to go?
Sure.
Okay. So breathing out, exhaling. Hold, 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 hold. 5, 6, 7, 8, 9, 10. Okay. So you do that up to 4 times, and then it should take effect after a few minutes. We'll do the same thing with the spacer. Now all this does is, the problem with these is if you don't get that coordination right, you could spray too early or spray too late, and it doesn't get all the medicine into your lungs. So this is a bit more efficient. So you just pop that on there. With these, you can keep them, you don't have to keep buying them. In just terms of looking after them, I'd say they need a wash with soapy water and just air dry. Don't get a brush or a flannel or whatever on the inside, because you'll scratch the inside. So, over there. Make sure this forms a nice seal over your mouth. So same thing, but this time the medication goes into this tube, and if you've missed any of it, it means you get more into you. Alright, you have a go? Beautiful. Alright, so that's that ticked off. Excellent. So that's when you're well. This is when you're not so well. You might find that you need to use the medication a bit more. So the medication doesn't change. Again, we're using the asthma, the salbutamol, Ventolin, whatever you want to call it, and it's 4 puffs is required. Now, if you're finding that you need to use that, say, every more than 3 to 5 hours, or sort of more than once a day, it's probably a good idea to go along to your GP, because it means it might be a little bit of a flag that things are changing, there might be something else going on, and you need a bit of a review. Also, I'd say go and see your GP, or the advice is to go and see your GP maybe at least every 6 months, but a minimum every year, just to review your asthma. I don't know if you remember that one of the ways we diagnosed you with asthma is we got you to blow into this big tube, and it gave us loads of readings, and we measured what was going on with your lungs. And if that's changing, the GP can arrange a similar test. Sometimes we use something called a peak flow meter. Sometimes we also use something different called spirometry. But they essentially do a very similar thing. They just measure technically what's going on with your lungs, and if that's changing, your GP will be able to give you some more advice and maybe send you back to a respiratory specialist. And then if you find it's getting worse, so you need it with more than 3 hours, you're having difficulty breathing, you're waking up at night breathless, like, oh my god, someone's sitting on my chest, this is, you need to seek help immediately because as you found when you had pneumonia, it set your asthma off, which made the symptoms of your pneumonia worse, and there's this big vicious cycle and you ended up in hospital in a fair bit of trouble. So we don't want that happening again, so make sure you seek help. And worst case scenario is you've got to call AAA and have the ambulance guys come out.
Mm-hmm.
All right. The good thing about this is you can take it as much as you need to. All right. If you take too much of it, it could make your heart race a little bit. You might feel a little bit like you've had a big dose of adrenaline, but they aren't. Although that's not ideal, it's better than not being able to breathe. All right. So that all makes sense. Okay. Final thing, you can almost go home. These are your antibiotics. All right. Amoxicillin. 1 in the morning, 1 at night. Make sure you finish the whole lot. Okay. Why do you think you should finish the whole lot?
Don't know.
Okay. It's what they call antibiotic resistance. So it means that you might kill off almost all of the bug. So your symptoms have gone away, but the bug hasn't gone completely.
Mm-hmm.
And then it comes back, and then it's resistant to the medication.
Okay.
All right, so you've got to finish the whole lot.
Mm-hmm.
Like I say, 1 in the morning, 1 at night, and take with food. All right?
Yep.
Great. You can go home.